They can also put a stent inside the patient's vessel. Okay, and it's like a little spring, a little tiny spring that goes into the vessel to kind of hold it open and keep it open. Okay. All right, next question. Now, this is a little harder. Okay. Okay. All right, so we got, a lot of you are saying B, and some of you are saying A, so let's go through this. When we have the highest priority, remember, NCLEX is going to ask you questions. These are all right? But which one do you see first, essentially? So it's an analytical question. Which one has the highest priority? Okay, so let's look at B. Blood pressure of 110/62, atrial fibrillation with a heart rate of 82, and crackles in both bases. Crackles in both bases. Blood pressure's okay. Heart rate's okay. They're an AFib though, atrial fibrillation, okay, which is a dysrhythmia. But their blood pressure's okay. Okay, all right. It's sparking my interest here. Confusion. Urine output of 15 mLs over the last 2 hours. Orthopnea. What's orthopnea? Difficulty breathing. So what do you have to do? Sit up. You'll see these patients sitting in a chair to sleep because they can't lay flat. Okay? All right, confusion. Am I concerned with confusion?
Yes.
I am?
Yes.
Why?
Because it's poor perfusion to the brain.
Say it again? What did you say? If it's a change? Okay. Urine output of 15 mLs?
That's bad.
Why is that a big deal?
It should be 30
It has to be 30 mLs. Who said? All right. All right. You went there. You went there. How do you know it's got to be 30 mLs? That's what all the books say, right? How did they come up with that? How did they come up with 30 mLs?
Half milliliter per kilogram, yeah?
Oh, you're smart. Yes. Okay. That is correct. But how did they come up with 30 mLs?
Because 60 kilogram is like average, but
He's absolutely right. He said 60 kilograms is average. If you look at something now, NCLEX can further break that down. You are correct, 30 mLs, and that's what we're taught, and that's a general average. But if you have somebody that's 6'2", muscles, bang, 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 right? All muscular, and then you have somebody who's like me, you know, like 5'1", not really muscular. You know, do you expect us to have the same urine output?
No.
Probably not, okay? So we use a general rule of thumb of 0.5 to 1 ml per kilogram per hour, okay? Children, we want more of the 1 ml per kilogram per hour because they're more water-based, but with an adult, we'll accept 0.5. And you said it's based on 60 kilograms, that is correct. Somebody said that the average American is 60 kilograms. Okay, just go with it, okay? I'm 60 kilograms. Okay, so 60 kilograms, if I have 60 times 0.5 per kilogram per hour, that's 30 mLs. That's how they come up with that. So 15 mLs over 2 hours. Not so good, right? Let's look at the next one. Pulse ox, SpO2 of 92 on 2 liters. What are our books saying now? What's the American Heart Association saying that's normal now? What is it? 94, above 94, 95, you're right. okay? So, okay, I'm a little concerned about that one. Okay, respiration's 20. +1 on edema, lower extremities. Let's face it, folks, I probably have +1 edema on my lower extremities right now because I've been standing all day, okay? All right. So, and then D, weight gain of 1 kilogram in 3 days. Wait a minute. Anybody, she said anybody could do it. That is true, especially the 4th of July weekend. Pretend it was a 4th of July weekend, okay? Let's say an average weekend. That could be pretty frightening for a congestive heart failure patient, 1 kilogram, right? We're on the road to maybe perhaps going into congestive heart failure, as I go out of breath saying it, right? Blood pressure, 130/80. Okay. Mild dyspnea. With exercise, okay? I get real dyspneic with exercise, okay? So, the one that made the most sense, even though they have parts of them that are all correct, right, is B. I'm not saying the other ones aren't important, but the most important was the confusion. Lack of perfusion to the head, okay? Urine output is low. So what's happening is my body's going to start going through shock. I have a lack of perfusion. So that means when say you get a job on the medical surgical floor and you have 10 patients and 5 of them are post-ops, you need to make sure you are watching your patient's urine output if they have Foley catheters, watching their mentation, because that's a great sign of hypoperfusion to the brain, especially if you know you didn't give them narcotics or barbiturates, and all of a sudden if they're confused now, could be hypoxia or hypoperfusion. Okay, so that is the one. If anybody chose B, that's the correct answer. See how easy that is? Okay. Okay, so what's happening in this picture? Stroke. Yes, absolutely. And I want to show you something really quick. It was on YouTube, and it made me so sad. A patient went to the emergency room, and I'll let you hear her story.
Sensation is happening again. Just
Have a
smile,
stroke.
they said. Smile.
She pulled over.
It's all tingling on the left side. On the left side. The doctor said to breathe in, breathe out, manage distress. And I'm trying. I don't know why this is happening to me. It happened this morning again. And when I left the hospital Monday night at like 12:30 in the morning. So now I'm taking a picture for an example of what happens. It's 6:43. My hand is hard to lift up and to touch something, to touch my nose.
Well, she was her best advocate, right? So the doctor said she's having stress. So, okay, and she's been to the hospital with these signs and symptoms. You're having some stress. Go take your Xanax, you'll be fine. She was having a stroke, so she was the best advocate for her. So, and she had those signs and symptoms that we as nurses need to make sure we're looking for. Use the acronym, okay? Face drooping. She had that, right? Okay, arm weakness. She had that. Okay, speech difficulty. Yeah. Okay, so the only one is time to call 911. She recorded it because she had been to the physician's office. She's been to the doctor's office. But you know what though? Kudos to her. She is educating all of us with her video.
I just feel bad for her. Like,
Yeah.
like, how did they miss it?
Yes.
Like, what?
But if she wasn't exhibiting those signs and
When they went
symptoms,
in.
I could perhaps see, but maybe they should have done further testing, like to see how well her carotids, or she had occlusion of the carotids. Remember folks, if you have clogged arteries, remember you got arteries everywhere, okay? It's not only in the heart. So it could also be in the brain, and I would also, give her a full workup with this. So there's two different kinds of stroke, okay? There's a hemorrhagic and there's the ischemic stroke, okay? And there are interventions that we could do for both, but the patient's gonna present the same. And depending on where it is, you'll see a little bit of, different changes, and you'll learn that when you go to the third semester, when you get stroke. But the signs and symptoms, these are the things we need to act on. And we know it's so serious and time is crucial that we have a stroke alert, right? We have an MI alert, we have a stroke alert, but I can't make fun of that one, right? Because MI alert, I don't know. But stroke alert, I don't know, I'll think of something, right? But a stroke alert is to heighten everybody's awareness that this is what's happening, somebody's coming in or is there, and we need to restore perfusion now because their brain cells will start to die. Okay? Okay, so what decrease of perfusion is happening in this picture? This is a little harder. It's a little harder. And you gotta use your imagination a little bit. Huh? I think you said it over there. Hydration. Oh my goodness, right? Can somebody have a decrease in perfusion because they're dehydrated? Yeah. Okay. So I tried to get a real person, but I couldn't. So I had to do a cartoon of this man sweating. And patients that come into the hospital, they get dehydrated so fast, right? So if you have somebody who is even like, we say the very old or the very young, right? The very young are made up of water, but so are the very old, because their lean muscle mass is being replaced with subcutaneous tissue. And subcutaneous tissue holds less water than lean muscle mass. So automatically they come in and you're at risk. Second thing is the elderly, what's happening with their thirst mechanism? It's decreased. Their thirst mechanism is decreased, right? So they may not feel thirsty all the time. People don't come into the hospital usually just to visit, right? Say, hey, I'm here, give me a physical, They come in because they're sick. And when you are sick, when your body is sick, your metabolic demand is increased, okay? Because it's gonna heal. It's gonna take care of whatever's going wrong with you. Increasing that metabolic demand decreases your, or it could make you dehydrated, okay? Because you need more fluid. That's why a lot of our patients just have IV fluid, just because. They're like, well, I have IV fluid. Because that metabolic demand is increased. A fever, you have a fever, okay? You're burning off a lot of water. You have that insensible loss, that loss that you can't see, okay? You're burning it a lot with an increased metabolic demand. So your patient's at risk for dehydration. How do we assess that? Okay, so we check our patient's skin turgor, and you are going like this. Okay, she's going like this, okay? So that is a great guess, and you're on the right track, but you never want to check the back of the hands, okay? Because you tend to lose elasticity as you get older, okay? So you want to check under the clavicle and the forearm, and you want to pinch the skin. And if it doesn't bounce back real fast, okay, that means it's tenting, and that's a sign of dehydration, okay? So never do the back of the hand. What else? How else would you check and assess your patient? Mucous membranes, yes. What would you see with the mucous membranes?
They dry.
Dry, okay, sticky, right? What about the tongue? Okay, be pale, okay. Furrows, did you ever see it's like a dry, like the Sahara Desert, there's little ripples in the sand, you'll get them in your tongue. So urine output, eyes, okay? Remember, every cell in our body needs water, okay? To be able to keep its shape and everything. So these things are the things that you could look at for your patient, because if you don't watch it, your patient could have a decrease in perfusion. So say I'm really dehydrated, okay? And my body has compensatory mechanisms to keep it alive for as long as it can. But eventually, those compensatory mechanisms no longer work. What might you see in a patient who's really dehydrated, okay? And we need that perfusion, not enough to go around though. What might you see in your patient? Signs and symptoms other than the skin, the furrows. I'm talking about vital signs. Low blood pressure, elevated heart rate. How come why does your heart rate elevated?